This is a video about a keyhole removal of a kidney called a laparoscopic nephrectomy. So I'm just going to talk to you about what the kidney does, the reasons for having the kidney removed, and a bit about the procedure and what to expect. So the kidney is an organ that everyone is born with. Most people are born with two kidneys, and those filter the blood and get rid of important toxins. It also makes sure that we have the right amount of fluid in our bodies. So most kidneys are about 12 centimetres long, and most sit in the flank, so just in the back and below the ribs, and they're protected by the ribs, of course. If we are going to remove a kidney, it's normally because we found a tumour in the kidney. Most tumours are found by scans, and most cause no symptoms when they present. Kidney tumours grow very slowly, so actually they grow about 3 millimetres a year. So normally when it's found, it's been there for a long time, and often that's important to say because it can help alleviate anxiety. Most patients worry that the kidney tumour is growing rapidly inside them, which is very rarely the case. If a kidney tumour is found, then obviously we need to assess that very carefully. We need to do very detailed scans, normally CT scans, to identify whether the kidney cancer is only located in the kidney or whether it's anywhere else in the body. And then from that we'll have a number of choices of how we manage it. We normally discuss the case in a specialist meeting where we bring lots of heads together to look at the scans and to get an opinion on what's the best way of treating you, and then we see you in the clinic and go through those options with you. In terms of the options for treatment, well, the scans can only tell us so far as whether this is a kidney cancer. So sometimes we'll recommend a biopsy, sometimes we'll recommend an alternative scan, but often we'll recommend an operation to remove part of the kidney or all of the kidney. If we were to remove all of the kidney, it's normally because we feel that it's not safe to remove just part of the kidney to remove the tumour. And we know that most people can have a kidney removed and not notice any change in their overall lifestyles. Most of the time a single kidney is enough to be able to remove all the toxins as we know that the function of the kidney does. So removing a kidney should have no effect on your lifestyle, although we will need to keep monitoring blood pressure and kidney function blood tests for a time afterwards. If there is a significant drop in kidney function, then there are other things that we'll need to monitor, and that can be done through a specialist of kidney function called a nephrologist. So in terms of the treatment, most kidney cancers are not sensitive to chemotherapy or radiotherapy, so they're very rarely used. So most of the time, it's the treatment of choice is an operation. However, as I said previously, as kidney cancers grow very slowly, sometimes treatment is not necessary at all, and we'll often just monitor things with scans. If we do decide that jointly as a kidney removal called a nephrectomy is the right option, then most of the time this is done by a laparoscopic approach, and that's a keyhole operation to remove the kidney. Before you have surgery done, then we have a pre-operative assessment clinic where we'll go through the procedure with a pre-operative nurse and also your fitness for the procedure, and that may require tests such as a heart tracing called an ECG and some blood tests. And they'll also go through specific things to use, such as if you're on blood thinners, when to stop them, and a little bit about what to expect from the recovery. You'll also receive some information regarding the surgery with some detailed risks and again what to expect from the surgery itself. On the day of surgery, then you'll be given starving instructions, and normally that means that nothing to eat for 6 hours before, and normally only clear fluids up to about 2 hours before. There'll also be some instructions obviously about where to go and any isolation periods if necessary. You may also be asked to do additional things such as a swab, and that can be done beforehand so that we have the results available for the day of surgery. On the day itself, then you'll be admitted by one of the nurses on the ward and then be seen by an anaesthetist to go through the type of anaesthetic that you're going to have, and then go through a consent process if it's not already been done, and have some important checklists done. You'll then go down to the operating reception area and then have the checks done to enable you to go through into the anaesthetic room before you have the anaesthetic required to then go to the operating theatre itself. So this involves small incisions that are made once an anaesthetic has been done, normally about 4 incisions, only just over 1 centimetre each. Through those we put in little ports which enable us to put instruments through those ports, and we can then dissect the kidney from its surrounding structures. Normally the kidney is surrounded by some bowel. It's often under the liver on the right side and under the spleen on the left side, and we need to free it from those structures and then free it from the important blood vessels that go into the kidney as well. The procedure often takes around 2 hours to do, and of course when the kidney's been completely freed, we still need to remove it. So unfortunately, although the operation is keyhole up to that point, to remove the kidney we need to put it into a small bag inside you and make an incision as long as the kidney and the growth is to be able to bring that out, and that's normally about 15 centimetres long. That's normally closed with either dissolvable sutures or staples. If it's staples, then they're taken out about 10 days after the operation, and it's not as painful as it might sound to remove them. There's a clip remover that is fairly straightforward to do. Usually you'll spend around 2 nights in hospital if everything goes well, sometimes only 1 night. You may have a catheter, which is a tube that drains urine from the bladder, and that's normally only there overnight. And you may have a drain, which is a tube that sits around the kidney and will drain any fluid off, normally any blood that might be sitting around the kidney after the operation or where the kidney was, and that's normally removed the next day. In terms of recovery, you can expect around 4 weeks to get over this. During that period of time, you just feel exhausted when you try and do things. You'll feel discomfort from the incision itself, particularly when you try and move, sit up, turn. Getting in and out of cars can be quite difficult. I would advise at least 2 weeks off driving, as you need to be safe to be able to do an emergency stop. And if you've recovered very well at the 2-week mark and feel safe, then that would be reasonable. However, if you don't feel safe to do an emergency stop, then you mustn't drive until you feel that things have healed enough to do that. It takes about 6 weeks to get results back, so we will see you back for recovery assessment in the clinic and go through all the results of what we've analysed at that point as well. And at that point we can go through all the follow-up that you might require, which is normally scans in the future going forward for usually at least 5 years. It's very rare that other treatment is needed after the kidney's removed, but again we can go through that when we get the results back in clinic. So it's very rare to have a complication. Most people experience pain. On the first night of the operation, the gas that we put in the tummy makes the whole tummy feel uncomfortable. Where we've had to extract the kidney from, that feels quite uncomfortable, particularly when you're trying to move around or sit up in bed. Coughing can be quite uncomfortable as well, but we will give you lots of painkillers to make sure that this feels okay, because breathing and coughing is really important to try and prevent things like chest infections. Other complications, then bleeding from the operation. A small amount of bleeding is quite common, but it's rare to have a large amount of bleeding needing a blood transfusion, but it is a risk. There is also a chance of damage to surrounding structures around the kidney. The bowel is one of the main ones that sits around the kidney, but again it'd be very rare to have any injury to these. You can have anaesthetic risks such as heart attacks, strokes, chest infections, but again these are all quite rare, and most people do go home after about 2 days. There are risks of having a clot in the legs or the lungs, and if we do feel that you're at particular risk of a blood clot, then we will give you some blood thinners to go home with. There is also a small risk of converting to an open operation if we have difficulty, such as bleeding during the operation. This is less than 1%, however, so very rare to happen. If it does, then normally you're in hospital for a longer period of time because the incision is longer than it would be if we just did the keyhole operation. Sometimes when we get the results back, we find that this is not a cancer. Overall, there's about a 5 to 10% chance that this would be the case. And most of the time, that's just excellent news because it can be very difficult to be sure that the tumour is benign or cancer before we take it out. And finally, if the remaining kidney is not as healthy as we hope it's going to be, or it deteriorates in the future, then there is a small chance of needing to have some support for that, and that would normally come in the form of dialysis. It's very rare that this would happen.
I'm here to talk to you about wound care. After you are discharged from hospital, you will have some small dressings over your wound site. The nurse who's discharging you may give you some additional dressings to take home. You are expected to keep these in situ for at least 24 to 48 hours after your surgery. After that period, you are expected to take the dressings down. You can shower at that stage. Please do be mindful not to scrub the wounds, as this can cause irritation. Please be aware that within those first 24 to 48 hours, you may see a small discharge. That's an ooze coming from the wound site. However, this is normal and doesn't necessarily mean that there's any infection present. Please be aware when you shower, do not use any perfumed soaps or body washers, as this may irritate the area. Please avoid bathing for long periods, as this can cause irritation to the wound site and cause potential infection. Please be aware to avoid swimming for at least 4 weeks, as this can cause inflammation and swelling to the wounds initially as they are healing, but you should also refrain from doing any vigorous exercise after your surgery. Once you have taken your wound dressings down, you will notice you will have dissolvable sutures in situ or clips. The sutures normally dissolve after 2 weeks of their own accord. However, it can be slightly longer for some patients. If you have any concerns about this, please contact your specialist nurse key worker on the information provided. If you have metal clips in situ, these will generally be removed by a community nurse, which may be a district nurse or a practice nurse, within 7 to 14 days. If you have a drain in situ, please be aware that this area and this wound will take slightly longer to heal. The nurse who is discharging you may advise you to keep your dressings in this area for slightly longer, and please be aware to treat this as any normal cut and graze as you take the dressings off, exposed to the air to promote healing. I'm here to talk to you a little bit now about your drain, if you have one placed in during your operation. This is a very soft, hollow tube that promotes fluid and secretions from the wound site and is generally in situ overnight after your operation. The nurse will then assess this area along with the surgeons the next day. If there are very minimal secretions coming from the area, this will be removed gently by the nurse. So the drain will have a small suture holding it into position. This is removed by the nurse and the drain is then gently eased out of the area. I'm here to now talk to you a little bit about catheter care. A catheter is a small hollow tube that is gently placed into your bladder during your procedure. This is to drain urine from the bladder into a catheter bag. The catheter will have a small balloon attached to the end, which is inflated with saline during the procedure. These are generally painless and patients normally find that they get minimal discomfort. This is normally placed in situ at least overnight during the operation and then is gently removed by the nurse caring for you on the ward the day after the procedure. Sometimes we have to send you home with a catheter in place if you find it difficult to empty your bladder before being discharged home. If you are discharged from hospital with a catheter in situ, please be aware that this will generally be in place for a minimum of 7 days. The nurses that are discharging you from the ward will give you catheter care advice and supplies to take home, and then you'll be seen in the community or with the specialist nurses at the outpatient clinic to have this removed at a later date. If you are struggling to get a date for your procedure to have your catheter removed, please be aware to contact your specialist nurse on the details given. Anticoagulation medication is given to thin the blood and reduce the risk of blood clots. This is a daily injection, and the nurse discharging you from hospital will talk you through how long you need to take these injections for. This is generally a painless procedure and you are expected to do this yourself or one of your carers at home. The needle is very fine and most patients say that they feel a slight sting, however, nothing too painful. Please be aware that you will also be given a sharps box to take home with you to dispose of your needles, and you are expected to take this to a pharmacy to be disposed of correctly. The injections are to be given into the abdomen, into the fatty tissue, and you will be shown how to do this by the nurse discharging you from hospital. So after your surgery, if you have any ongoing concerns, please do not hesitate to contact the urology nurse specialists. You will be provided with the telephone number to contact us on. Please be aware that we are available Monday to Friday, 8 till 5, excluding bank holidays. Concerning signs to look out for include worsening pain, that is pain that is getting worse rather than better. You should generally feel some discomfort after your surgery that may last anything up to 4 weeks. However, if the pain is increasing, you may need to speak to an out-of-hours doctor, your GP, or if this is acute, go to accident and emergency. If you have a fever, which is new to you, and you have got any signs of an infection or start with rigors, which are shakes, again, you may need to seek emergency care. Please be aware that a persistently discharging wound can be a sign of an infection, and you may need to see your GP for this to be examined, or contact the out-of-hours doctor, or again, accident and emergency if you are concerned. You may feel generally unwell for a few weeks after your procedure. However, if this is lasting and you are concerned, again, please get checked by a GP, out-of-hours doctor, or if this is worsening, accident and emergency.